Good morning, everyone. Today on Perspectives, we talk to the health officer for Mobile County. We find out an update on COVID-19, how are the conditions locally, and are we out of the danger zone? What changes were made in the past month, and how we should be conducting ourselves now as we live our daily lives. Well, 3 weeks ago, Mobile County, the state of Alabama, and the nation turned a corner as the federally declared public health emergency for COVID-19 expired. Health officials in Mobile, Montgomery, and Washington say that case numbers, hospitalizations, and deaths from COVID-19 are significantly lower than during the surges of the virus. In the last 7-day period reported, Alabama, Florida, and Mississippi had no cases or deaths in their states. According to the Alabama state health officials, we've entered a new phase, but the disease is still causing suffering and death in Alabama. Health officials say that they will continue to monitor the effects of COVID-19 in the state and respond to any future surges or developments. In the last 3 years, Mobile County had the second highest amount of cases and deaths in Alabama. There are nearly 136,000 cases, and more than 1,800 Mobilians died. Health officials say that if you have signs or symptoms of the disease, you need to be tested and seek medical care when ill. COVID-19 testing remains available, and the federal supply of the COVID-19 vaccine will be available at no charge. That is, until the current supply is exhausted. Well, today our guest on Perspectives, health officer for Mobile County, Dr. Kevin Michaels. He has been in the office for a little more than a year now, succeeding Dr. Bert Eichel last year in February of 2022. Dr. Michaels has several certifications, including preventative medicine, public health. He is also licensed in Florida, Mississippi, and of course, Alabama. Well, after a quick break this morning, we hear from the health officer for Mobile County, Dr. Kevin Michaels, as we talk about COVID-19 and the update on the former pandemic in June of 2023. Perspectives continues in just a moment. And welcome back. Our very special guest this morning, Dr. Kevin Michaels, the health officer from Mobile County. Thanks for joining us this morning.
Thank you.
It has been an interesting 3 years, and I guess you can look back and give us an idea of what we've learned from the experience of this pandemic here, not just in the nation, but here in, say, Mobile County and the state of Alabama.
Well, we've learned quite a bit, and we've put a lot of processes in place from the early days where there were only one or two places where people can get vaccinated once we did have a vaccine. And now most groceries, pharmacies have vaccine available. Many doctors' offices have vaccines available. We have the Festival Center under the health department that are providing vaccines and rapid testing to folks. So we have all those things. Now, the public health emergency kind of changed it a little bit in that we still have those supplies that we'll continue to provide. But as we move through, our current contract sort of ends around 1 October at the Festival Center, and we'll provide vaccines through the health department on case by case. But it's still available at pharmacies, grocery stores, and doctors' offices. So we've developed the vaccines. The CDC actually came out with some simplified vaccine recommendations. And the current recommendation now, anybody 6 years or older, healthy, should get the bivalent vaccine, 1 dose. And those people that may have other health problems that their immune system is not as strong should get a 2nd dose of the bivalent vaccine. So we had gone from having multiple different shots. You know, some people have got as many as 6 shots. Now, if you haven't been vaccinated, just getting that 1 shot if you're healthy. Additionally, our knowledge has expanded in that we have a lot of rapid tests available. Some of them are, you can request have it shipped home. And so there's, the testing is available throughout the community and available, many grocery stores and pharmacies from that standpoint for a cost. So we've come a long way, and really the public health recommendations have changed.
Well, let's look at one of the questions, I guess, when you evaluate what has happened over this period of time with the pandemic. Is this how they usually end as you look back on some of the others and
Yeah, I mean,
going through in history?
You know, a lot of people have developed COVID and they've overcome their symptoms and they're back to normal health. Now, there's some people that have, you know, such as long COVID symptoms. But for most people, they've had the illness, they get better, and they have some degree of immunity. But again, the vaccine is also additional to there. So you sort of have that herd immunity where people have gotten sick and developed natural immunity. There are people out there that have been vaccinated and haven't really developed COVID. And so those numbers have increased. And so there's a large amount of immunity in the community. However, those people, there's still some people out there that have been quite fortunate and never did develop COVID and maybe never got vaccinated. They're still at risk.
Are they in the minority per se?
It's hard to tell. We really don't have that picture of who really had COVID or not. You know, if they got to a doctor's office and told they had COVID, testing, yes, they had COVID. But there really isn't anybody to go out and test, did I have COVID or not? There isn't a test
survey
out there.
taking that.
So,
yeah. So when you look at the overall effect of COVID as it was experienced here in Mobile and this part of the state of Alabama, do you think that we handled it all in the way that, considering what we knew at the time, we were able to get it in control, or
we did our best, and to my knowledge, a lot of it occurred before me occupying the position. The hospitals, the concern of the hospitals was that, you know, are they going to have beds available? And a lot of the recommendations that fell into place from the national, the state, and the local, you know, masking, we sort of slowed the illness, and that we really didn't have the, I mean, the hospitals were full, but it wasn't to the point that they were closing.
Right.
So we met that requirement.
When you look at the numbers, we were number 2 behind Jefferson County. What was the difference that happened in Jefferson? Because I mean, we were almost, they almost doubled us. Well, nearly 3,000 up there in the death number, and their number of cases far exceeded where we were. What happened in Jefferson County that we were not, well, I guess you could say we were fortunate here not to experience it the same way?
I can't say specifically difference between Jefferson and Mobile. I can sort of speculate that, you know, Jefferson County or Birmingham, a larger city, a large amount of people live in that area, and you know, ended up going to the hospitals, major referral area for the state and for that part of the state. Mobile County, again, the same thing. We had a lot of you know, a lot of referrals from the surrounding counties. So it's hard to say, other than, you know, being a larger city and people coming in close contact.
Just like New York City and California, many of the places out there.
I mean, there will probably be studies to go on into the future why something is different from a city in the Northeast versus cities in the Southeast.
When you look at the way that the public responded to what was recommended and what the health department and the medical community was sharing, do you think that we could have done better as far as we, the public, and following recommendations?
I think that's always going to be a challenge. We can go back in time and say, hey, if we responded a little bit better, we would not have had as many people sick. And unfortunately, there were deaths, and we can't forget that. But we made it through. You know, there's some people that are not with us today because of COVID. So it's a challenge. You know, looking at the recommendations of, you know, whether to mask, social distancing, whether stay home, those were all things at the time was the best recommendation to get us through. We, you know, early on, we did not have a vaccine. We did not have a treatment, and those were rapidly developed to support that. But we still wanted to slow the disease process. And you know, one of the things that did occur is that the large number of people presenting with illness And really, we lost a lot of healthcare providers along the way.
We sure did.
Those that may have died in the line of providing healthcare, and those that decided, hey, I'm ready, I'm not really wanting to do this now. My life is more important. And so, that changed the whole dynamics of what the community's response, would be.
So it was a lot to learn when you think about a pandemic, and even in the year, 2020 we were dealing with, we still had a lot to learn as far as how to pinpoint and to deal with it. But overall, it happened fairly quickly when you look back on it, wouldn't you say?
Yeah, I mean, we went from 2019, people traveling, start of 2020, coming to a screeching halt. And, people being asked to stay home or told to stay home. That changed a lot. People had to reassess their life and what they can do. Made it hard for people to sustain having jobs. Some people were told to stay at home and they weren't being compensated. There was a lot to learn on a social level, not only on a social level, but also on the medical level of recommendations. When I was seeing people, the early recommendations was they were to stay home until they had 2 negative tests.
Right.
Based on that technology. There were people staying home up to 90 days and they weren't ill. And that was causing frustration.
Major changes, both from the medical and the social side. We're going to take a break on that point, and when we come back, we're going to talk more about where we were, what we've gone through, but most importantly, where we are now and what's next as it relates to handling the COVID-19 virus. Yes. Our very special guest, Dr. Kevin Michaels. Perspectives continues in just a moment. Welcome back. We're talking this morning with Dr. Kevin Michaels and giving an update on where we are now with COVID-19. We thank you so much for joining us today. Some of the numbers that I have, you were telling me that it varies of who the reporting agencies are, because we have had a few cases here in our area. So what you think of the result of those? Are people traveling or people just finally getting exposed to the virus?
Well, 11 May, the public health emergency was over, and there was an assessment through the public health, through the CDC, and with all the hospitals, and how we're going to report cases. And they went from almost a daily reporting to a weekly reporting. And that weekly reporting is just those people who present to the hospital and are hospitalized due to COVID. Okay. There have always been cases in the community of COVID illness. I go home, hypothetically, I go home, I test myself with a home health kit, and it comes back positive for COVID. I technically have COVID.
Right.
Do I go to a doctor or not? That's an individual decision. How severe my symptoms are, and there are recommendations out there to you stay at home until you're symptom free for at least 5 days. You wear a mask, you protect others in the household, and then when you're back to normal, your normal state of health, continue wearing that mask for another 5 days. Okay. All right, so you can go back to work, you can be out socializing, and I'm not saying a person wearing a mask today is due to the fact that COVID, people can wear a mask because they have health concerns that they don't want to needlessly be exposed. And so, continue practicing social distancing, washing hands. If you're sick, stay at home. Wearing a mask are all appropriate individually if that's what you want to do. So with the changing, the required changing, so on Thursday, all the hospitals would report their numbers, and based on those numbers, there is a chart that we can look at to tell what the next week of recommendations would be when if it comes to COVID. And our numbers for the community are pretty low. We're still in the green, so wearing a mask is not necessarily required. Life is normal, but those people that may have other health conditions, should one get vaccinated or put whatever measure in place to protect themselves or others in their household.
What are some of the things that people may have as other health challenges that they should be concerned about protecting themselves
Well,
in certain environments?
you know, a person who is immunocompromised, whose immune system is not working at its fullest capability, those people should be very cautious in how they engage other people in the community. Not necessarily from a COVID, but from any other illness. So you'll see that, and they may be the ones wearing a mask, or they may be somebody that's come, post illness.
So if you're in, say, restaurants, maybe in church, or anytime there's a large gathering of people, you should be aware of
a large gathering,
social
but it doesn't necessarily have to be a large gathering. It could be one person, in the store. Yeah. So just practice. I mean, we've learned a lot. Practicing social distancing, cough etiquette, washing our hands, terminal cleaning of shared items. Those are all still appropriate to minimize any illness, that's out there. Influenza-like illnesses, influenza, cold viruses. Just doing those things will protect an individual and allow them to stay healthier.
You mentioned influenza. How did we do this past flu season in comparison to the year before, when more people were wearing masks?
Well, the numbers were pretty low. We actually peaked out from the influenza-like illness, which is not influenza, but it's sort of every other cold illness that we would have. We sort of peaked before Thanksgiving, and we started dropping down, and right at this point we're below what our previous year's experiences has been.
So hopefully that's some of the education that we've learned too, right?
True, exactly. I mean, just reminding people we've come a long way, and we've given greater emphasis towards social distancing. Hey, you're in my space. Let me take a step back. You don't have to be that close to me. And you could see that from that standpoint.
I know sometimes in different locations you'll see people wearing masks, and there are areas that I think, for me, I start thinking, do I need a mask on in this environment? But I think you laid out some of those concerns and different situations with your immune system, your health challenges. You should know where you should make those proper decisions. And I guess check with your doctor as well to say, what are your recommendations for me considering my health?
I mean, the use of, the recommendation of the use of masks shouldn't be taken lightly. There are some people that just have a hard time understanding people speaking. They're not seeing people smiling. And so there's that social isolation from that standpoint. Other people see it as an opportunity to they have control, they can protect themselves. Or if they feel they're ill, they want to protect the other people they're coming in contact with. And there's nothing wrong with that.
Not at all, not at all. So talk about the getting the vaccine now at this stage of the game for those who either haven't gotten it or they didn't get all of the boosters.
Well, if they didn't get all the boosters, the question really to ask their provider is, hey, my last dose of COVID vaccine was the new improved bivalent. Do I need another shot? No, you don't. All right? Unless, of course, you have a chronic illness that puts you at a lower immune response. You should get 2 bivalent shots. All right? But those people that have received the bivalent shot, they got, probably since about January, they got their bivalent, they should be good. Those people that have never been vaccinated, they should go out and get 1 dose of the bivalent unless they need the second one. And it's 6 years and up. All right, if you're not, for whatever reason, you have an allergy to the bivalent vaccine, there still is the Novavax, which is a monovalent, and the J&J vaccine are still available in certain markets. You can get that, but you have to fulfill that vaccine requirement. So the Novavax would be 2 shots from that standpoint.
And again, you talked about the locations for the health department where there's still shots available at some of the clinics, like the Festival Center.
So the Festival Center, we still have a supply of vaccine available. Again, many of the pharmacies and grocery stores do have vaccine available. There may be a nominal fee based on their health insurance or other things, from that standpoint.
Got about 30 seconds. Close us out with where you feel we should go from this point on.
If we do the appropriate things, we should have a great summer and a start of another school year. And hopefully we will not have to have any mandatory requirements put in play. So
a lot of people, especially that school part, are excited to have their kids
get vaccinated and stay healthy.
All right. Dr. Michaels, we thank you for joining us for a conversation this morning and some great information. Of course, this program will be available to watch back on YouTube as well as the website so that this information can go forth into the community. We thank you very much.
All right. Thank you.
For more information, you can contact these different numbers at our Mobile County Health Department, the main office downtown. There are the hours as well as the main number for medical appointments. There's information as well. And then, of course, general questions can go to the info@mchd.org. And they're available on Facebook as well as Twitter. And, of course, youtube.com as well and Instagram. We'll have more information available for you, of course, on our YouTube channel as well as our website. Well, we thank you so much for joining us here on this episode of Perspectives. We'll see you here next Saturday morning. Until then, have a great week ahead.